Hi, just thought I'd do this video about some of the menstrual issues I've been having. These have been happening for most of the year. They're new. I'd love to hear from anyone having similar experiences. It'd be great to chat about it, see what's going on, see what the possibilities could be. And also just to really highlight that if you're not 100% sure on what your doctor is suggesting, and if you think further investigations need to be had, then it is perfectly fine to do that, which is what I did yesterday. So I'll go back to the start. So I'm 44 years old. I always have to think about that. But I'm 44 years old and I do live with dermatomyositis, among other chronic illnesses. And whether it was part of these illnesses or not, my period stopped about 1.5 years, 2 years ago. And this year they came back. So they came back around February, March, I think. And I think the first period was fairly normal. And then I did wonder, am I going to get another one? And I did. So it came back. And I think it was fairly normal, but then it came back again 3 days later. And I don't just mean that one where sometimes, you know, you think your period's finished and then it comes back. You have a day with none and then it comes back for a day and goes away again. This came back and stayed. So there was a fair amount of spotting in between. And then I think it was the next period after that, I just bled so heavy. It was like nothing I'd ever experienced before. Really, really heavy. The minute I even stood up, you know, it was just constantly gushing and lots and lots and lots of clots. Really, really big clots. So I would bleed for about 14 days and then I would spot in between that. So I just felt like I was always bleeding. At some points I was getting pain in between, so in between a period I'd just randomly be sitting in the car driving and I'd get really quite crampy, and then I'd go to the toilet and a clot would just pass. So when this seemed to be, right, this is the norm now, this keeps happening, I better think about what it could be. Obviously I did the Google search and what kept coming up was fibroids. And then obviously fibroids symptoms are quite similar to cancer symptoms. And I didn't spiral, I didn't think, oh my God, I've got cancer, you know, but because of dermatomyositis, you're at an increased risk of developing cancer, or it could be that a cancer that has been developing has caused the myositis. So I'm always aware of those things. And I do get screened for a lot of cancers because I have dermatomyositis, so my lungs get scanned a lot. I get abdominal scans, things like that, MRIs. But I haven't had a pelvic scan for a while. I did have a pelvic scan in 2018 when they were trying to figure out what was wrong with me when I was starting to get ill. And it did show that I had a small fibroid somewhere. And I recently had a large polyp removed. So in my head I'm thinking that's probably what's happened. Either the fibroid has grown and is now causing me bother, or it's grown and multiplied. But at the same time, I was also feeling like there was something obstructing down below. You know, I'd have like a wee feel in the shiver and I'd be like, there's something there that shouldn't be there. So I decided to call the GP. And because of COVID, I had to wait for a telephone appointment. So when she did call me, I'd sort of said to her, you know, I'm having a lot of bleeding. Straight away she said, oh, it'll be your age. When you get to this age, these things happen. Your periods can go a bit haywire. What I normally do is just suggest that you have a coil fitted. And I was saying to her, but I feel like there's something down there. She said, oh, what is it you're thinking, you're feeling? I was like, well, it feels like, you know, something quite bulgy. She was like, well, just nip round. I literally live right round the corner from the GP surgery. So she said, just pop round and I'll examine you. So I did, I went round, she examined me and she said, no, what's happening is that's like your pelvic floor that is causing that feeling. It's basically, your pelvic floor is really bad. So I'd said to her, you know, part of the myositis that I have is in my pelvic muscles. And she said, absolutely, that will be causing that. So I went to physio about that and I'm dealing with that. But I was really quite shocked that she instantly just said, it's your age. She didn't take any bloods to make sure if my hormone levels are dropped or anything like that. I mean, I'm not a GP, but I would assume they would do some kind of check first to rule out anything sinister. But no, she just kept saying, no, get this coil, I'll send you the information. She printed off leaflets, said she would send me a video and I'd have to consent to get this coil fitted. So I came away and I felt a bit relief initially, but then I thought, I'm not really happy with that. Like, you know, I am at increased risk, and while I'm hoping and I'm assuming, yep, it is what she says it is, it's going to be like perimenopause type thing, then I can just get the coil and that will help it. But I just thought, but I wouldn't want to risk it being that and not have investigated it first. So I kind of mentioned it to my consultant on the phone one day, and I said, you know, is it safe to assume that it's perimenopause? And he says, well, no, I don't think it is safe to assume, not if it's new symptoms that you're experiencing. I said, yeah, it is. And at this point, you know, my bloods that he's been taking to check for my dermatomyositis and stuff, they've been all haywire, and I'm very anemic, stuff like that, which I had said, you know, probably the fact that I'm bleeding so heavy. And he didn't seem convinced. He sent me for an abdominal scan, which I'm still waiting for the results of that, but that's a separate matter. So anyway, I just kept thinking, you know, I'm really not happy with this. And then I got another period again. It just really, you know, strengthened that thought that this isn't right. There's too much blood, there's too much clots, and it's going on for a prolonged period of time. You know, there's not very much days in the month that I'm not bleeding, which I know can be symptoms of perimenopause. But anyway, so last week the nurse called from the surgery and said, oh, I'm just booking in the people to have their coils, so I just want to get you booked in for that. And I said, oh, I was waiting on a video. She was supposed to send me, the GP was supposed to send me a video and a consent form. And she said, oh, well, I'm not very good with technology, so I'll just have you come and pick up a consent form. So you okay just to get booked in for your coil? And I says, well, no, actually, I really wanted to speak to the GP first, because there's a few things I'm just a bit unsure about. And she said, oh, what is it? So I told her, you know, I've got a condition that means I'm at increased risk of cancer, and I did potentially have a fibroid. So she said, okay, right, what I'll do is I'll leave a wee note for the GP and get her to give you a call. So the GP called me yesterday, and I don't know what the nurse wrote, but the GP rang and said, oh, I hear, yes, so it's about the HRT and the coil. And I said, the HRT? She was like, yes, I was having a look at your notes and I was thinking the HRT, I'm not really sure which medications is safe for you to take, but all these other ones that you're on, because I'm not really familiar with these medications that you take, would you feel fine asking your consultant? And I thought, HRT? Is the HRT in the coil? And she said, no, she said you can get the HRT when you get the coil. She was like, you left a note with the nurse saying about HRT, and I said, no, I didn't. She was like, oh, is that not what you said? And I said, no. And I explained to her about the cancer and stuff. And I said, so what I would like to happen is, could you refer me for a pelvic scan before we go ahead and have the coil? And she actually said yes. So I felt very good when I came off that phone call. I felt like I'd been a bit proactive. I haven't just left it waiting to see, oh, we'll wait and see what happens. So she said it will be about 3-4 weeks. But I'm really happy that I made, you know, I felt really assertive when I come off the phone. I felt I'd been proactive in my own health care. But again, I was just really quite surprised that she thought I'd asked for HRT and she was just going to give me it. Like, that boggles my mind a bit. You know, like, why would I need the HRT? But anyway, I'm glad. So 3-4 weeks time, I should get a pelvic scan, which should then tell me if the fibroid has grown or increased, or if there is anything sinister going on. And if it's all good, then great, I can go ahead and get the coil, knowing that everything's been checked before I've done that. And then hopefully, she did say the coil can take about 6 months to work, and then hopefully I won't be getting all these horrendous menstrual issues that I've been getting. So I would love to hear from you if you've had any similar circumstances, whether it's turned out to be sinister or whether it's all turned out to be great. I would love to hear your stories, so comment below. See you later.